Of course, we still have work to do. The job's not done, and hence your work at the Penn State Cancer Institute. I wanted to ask you a little bit about the Cancer Institute, and I know that since you've been here directing it, a big area of focus has been to achieve NCI, National Cancer Institute certification accreditation. But could you talk a little bit about the Penn State Cancer Institute and what your vision for it is?
Yeah, so the vision for the Penn State Cancer Institute, and you use the right term, and that is, it is Penn State's Cancer Institute. And so we have members, and and most of the members are faculty members at Penn State University that really are on a number of different campuses. A majority of them at the moment are on the Hershey campus, which is where the medical school and main medical center is. But increasingly we have members who, such as yourself, obviously, who are based at University Park. And so the Cancer Institute itself is a collection of scientists and from all walks of science, if you will, and individuals engaged in social policy, but all fundamentally working on cancer-related issues. And we bring them together in an environment where there can be collaboration, there can be interaction between them, research activities that are not so much anymore one person sitting in their lab or sitting at their computer doing work, but interactive work between lots of individuals. And it's bringing them together. And currently, so when I arrived about 3 years ago or so, we had maybe about 120 members of the Institute, with probably about 25% or so of them at University Park, 75% at the Medical Center. We're now close to 200 members, with 40% or so of the members being based at University Park and 60% at the Medical Center. So we've had enormous growth, and that's led to really innovative research programs that we haven't had before. But at the end of the day, it's all focused on improving the outcomes for patients with cancer.
Right. And what's the value of the NCI accreditation status? What does that do?
So it's a gold star we can put on our lapel, and it's something we can hang out on our shingle that we would really like to have. But more importantly, it's a acknowledgement by the National Cancer Institute that we're doing everything right in their mind. And so what we would do is join an elite rank of, at the moment, 70 plus or so cancer centers or institutes around the country that have gone through a very rigorous process whereby the quality of the science we do, the excellence of the patient care that we provide, the outstanding clinical science we do in terms of what are we doing for bringing new therapeutic modalities and applying it to patients, and then what are we doing with regard to population science. So for us at the Penn State Cancer Institute, we are the only tertiary academic medical center, at Hershey at least, in central Pennsylvania. And we cover and we extend up to Center County here and University Park. We have about 4 million people that we in aggregate care for and see. And so it's really doing research that is directed at the specific needs of our population, which are going to be very different, for example, than the needs of the patients and individuals in downtown Manhattan, downtown Chicago, what have you.
Yeah, I was going to ask, I think more and more cancer care, as I understand it, is being provided in the community in conjunction with academic medical centers. And of course, in our catchment area, we have a lot of rurality in terms of rural areas. So your focus too, as well, I assume, with NCI designation, as well as the quality of care, is to make sure that those various sites, patients are getting good quality care and coordinated care and such. I imagine that goes along with it.
Absolutely, it does. And there are a couple ways to view this. So, we at Penn State and the Cancer Institute are referred to by the NCI as an emerging center. It's not a very flattering term, but it's better than a wannabe center, okay? And as a emerging center, there are centers that are very well established. And so, for example, a very well established center that just dominates their region, if they had a slogan or a pitch they'd have, they would say it's the academic difference. Mm-hmm. It's what they have. What we at Penn State are looking to do is really, yes, we do believe we have a bit of an academic difference for sure, but it's really the academic community partnership. And that gets to the fact that because of the rural nature of those 4 million, of where those 4 million people live for the most part, that we have to really work closely with our community colleagues to really ensure that patients get optimal care.
Mm-hmm.